Hey, my name is Jordan Garman. I'm here at Cardiac and Pulmonary Rehab at the hospital, Wake Forest Baptist here in Winston-Salem, North Carolina. I'm going to take a second to go over our pulmonary rehabilitation patient assessment, and we have patients complete these prior to beginning pulmonary rehab and upon completion of their 36 visits here at pulmonary rehab. And these are important because they kind of gauge like certain factors like the patient's mental health, nutritional health, their understanding of different pulmonary diseases, and we kind of score patients before beginning the program just to see where they're at, to get a baseline reading of how they're doing. And then we do another assessment upon completion so we can see what things changed and what things remain the same, what aspects they may need to work on, and what aspects they've gotten better at. So on the first page here, we have a knowledge assessment that the patients complete, and we have different ratings. They either select 1 for true, 2 for false, or 3 for not sure. And I'll just go over like one of the questions. Emphysema is a disease that primarily affects air sacs. Another question up here is people with chronic lung disease can abruptly stop taking a steroid medication such as prednisone at any time without ill effects. And another question is bronchodilator such as albuterol gets rid of infection. And simply for this, like, we'll have the patient either select true or false or not sure, and then after that we'll add up their scores, and then we'll get an interpretation based upon whatever score they receive based on their answers. Another aspect of the assessment is we have the University of California Shortness of Breath questionnaire, and this pretty much asks the patients to rate their shortness of breath like while completing activities of daily living such as brushing their teeth, mowing the lawn, and walking on a level at your own pace. And for these, we have the patient select a rating of either 0, which is none, or either 5, which is they're breathless. And we also have like activities such as shopping, vacuuming, doing dishes, picking up and straightening around things in the house. And then we make an interpretation based on their score at the end of this too. And this just has them to relate to things that they do around the house every day and trying to gauge like how short of breath they may be. And then we also have them fill out a physical activity questionnaire just to see how physically active they are throughout the week, so we can gauge what type of effect coming to pulmonary rehab would have on them, because we have them participate in 2 20-minute intervals of aerobic activities such as walking on treadmills, walking laps around the facility, getting on the new step, just different things of that sort. And another aspect is we try to see how our patients cope with stress. So this is a part of coping strategy. So we ask them what their stress level is. Are their family and friends supportive? Are they receptive to the staff recommendations that Tony and Bill give them? And then we try to see how they deal with different types of stress. Like, do they meditate? Do they play games? Do they go to see movies, watch TV, garden, just to try to see what their stress levels are and how they try to deal with these in a healthy way. And then we also do a PHQ-9, which is checking to see what type of problems the patients are dealing with. So we check this on their appetite, if they're feeling tired, if they have trouble falling asleep, just trying to gauge their different patterns at home outside of the facility. And then this is the rate your plate aspect of the assessment, and this just checks to see like the eating habits, because that's an important part of each patient's daily life. Like, what type of nutritional habits do they have, such as like, are they eating enough grains, enough dairy? Are they eating takeout too much? Are they eating too much red meat, cold cuts, just things of that sort. And then we also get a score based off of this to see if they need to improve on their nutrition or are they getting enough of the daily values of certain aspects into their diet. And at the end, we just, at the end on the back, we just tally up their scores and then we compare them to pre and post assessments. And in this next portion of the video, we'll be talking with the patient here, and she's gonna be doing her post-assessment and getting her scores back to see her percent increase and see what aspects of the assessment that she improved on, which one she stayed the same with, and kinda how pulmonary rehab helped her. The following portion of my video will include my supervisor and a patient discussing the patient's information. Due to HIPAA regulations, I am not able to include the patient's name or the patient's face, but it's still a lot of valuable information that will be obtained in the video. This information is really going to be targeted towards future interns so they can see how important pulmonary rehab is and how effective it actually is based on facts and numbers that my supervisor will be giving to the patient so they can see how much they've progressed throughout their time at pulmonary rehab.
So you started with us on February 15th, 2021. And at that time, we did a 6-minute walk on that day, and you walked 1,100 feet, which is 334 meters. Based on your age, your height, your weight, and your sex, they come up with a predicted amount that you should do in a 6-minute walk. It does not take into account anything about your health. So at that time on February, you did 61% of what was predicted for you. So now that you're graduating, you did another 6-minute walk to compare. And today you did 1,750 feet, which is 532 meters, which equals you had a 60% increase in your 2-minute walks, which is incredible. That's really good. Now, the significance of that is, if you can relate, at the beginning, you were walking at 2.1 mile per hour pace. Today, it was 3.3 miles per hour pace, which is excellent. Now, the other things that we've got to compare from beginning to end is the outcomes questionnaires, which is one is the knowledge test on chronic lung disease. At the beginning, you scored a 94% on that, and today it was 100%. So that increased. Your San Diego shortness of breath, which is a questionnaire that lists a bunch of different activities, and you mark how short of breath they make you feel. At the beginning was 76, and today was 24. So that decreased by 52 credit points, which is another big decrease. That's incredible. Another shortness of breath score, which is called the MMRC scale. At the beginning, you rated the highest, which was 4, which is indicating that you either get very short of breath even getting dressed, or you're too short of breath to walk out of the house. Today it was 0, so that was another big decrease. Your symptom questionnaire that goes over different symptoms and how often you have those dropped from 32 to 9, which is another big decrease. We also do a questionnaire to check how you feel about your depression level. And at the beginning, your depression level was around a 15, which is right at that moderate level of depression. Today it went all the way down to 2, so you decrease that by 13. Which you and I have always talked that, as you've said before, the social aspect of pulmonary rehab is something that totally helps us well. So we have 2 more questionnaires, one which helps check your anxiety level. There again, at the beginning, your anxiety was a little bit on the higher side at 7, and today it would drop all the way to 4. Which there again, less shortness of breath, you expect less anxiety. And last, we go over nutrition. It's the Rate Your Plate questionnaire. At the beginning was 60, which is a good score, but 60 is at that level where you can make a few more healthy choices. Today, it went all the way up to 75, which is the very top level. That is backed by the fact that during pulmonary rehab, you lost close to 30 pounds, which shows your nutrition went a lot better, plus you started exercising more, and that's how you actually dropped the weight. So all of that in 36 visits. So what we need to know right now is the main thing: how do you plan on keeping up your exercise?
So I have worked out a program with Bill where I'm going to continue to lift weights, but I'm going to switch to free weights instead of machines. And I'm going to go to the Y, and I'm going to maintain 3 times a week, and I'm going to work the total body, and I'm going to do cardio weights, like I have been here.
Okay. And real quick, one thing I've seen on your paperwork, you're on a special nutrition plan. What's it called?
Yeah, OptiFast.
OptiFast. What is that?
So it's through our weight management program here at Wake, and so it's where the majority of your meals get replaced with shakes, and they want you to eat or have an eating episode, is what they call it, every 3 hours from the time that you wake up until the time you go to bed, and you're maxed out on a certain amount of calories. For me, it's 1,100, although on the days that I do rehab, I can have another 100 calories if I need it. And so it's mostly shakes, but I do get a snack and a meal, and my meal has to be healthy and follows all of those rate your plate recommendations.
Well, it's definitely working. That's for sure. And with you, I feel very confident that you're going to keep up your exercise. I know, that's important to you. The biggest things that I would recommend is keep doing the things that help to decrease your anxiety and your depression level. Get the social aspect any way you can. And you always have our phone numbers in case you need to call us back, or we can help in any way.
Thank you.
All right.
I have a couple questions to ask you. Reflecting on your pulmonary rehab experience, what do you feel changed about you the most from start to finish?
Everything.
Yes, ma'am.
I mean, I couldn't do anything when I came here. I mean, I couldn't even, you think I'm not moving around, I'm sitting on the sofa, I could be reading a book, I could be watching TV, I could be, wasting time that way, but I couldn't even do that. I couldn't stay awake for that long, and I couldn't focus. And so, and that was at rest. And then certainly anything that involved me exerting myself, even like light housework, I couldn't make the bed without stopping to catch my breath. I couldn't fold a load of laundry. I couldn't shower without having to stop and rest. Stairs were once I went downstairs, I was down for the day, until it was time to go back up. And now all of those things I can do, and most of the time I don't even have to think about them. So it's just everything in every way.
And I know you've probably set some goals for yourself. Do you feel like you've reached any goals that you set for yourself, and what are these goals that you have?
So I don't know if I had concrete goals when I started pulmonary rehab, except to just get better.
Yes, ma'am.
Kind of, not otherwise specified. And so I think I've far exceeded my expectations for these 3 months. And but I do have other goals past this, which is to I want to continue to lose weight, and I want to continue to get stronger. I really enjoy lifting weights, and I want to get to the point of where I can kickbox again, which is something that I did before and that I really enjoyed.
Yes, ma'am. And my last question, would you recommend this program to an individual going through a similar situation as you, and why? And which aspects of the programs were most beneficial to you?
Yeah, so I would recommend this for anyone who had COVID, anyone who has lung disease. I think this could benefit patients who don't have primary lung problems, like our cancer patients who are in the hospital for a long time and get deconditioned. Yes, I think there are so many patients that a program like this could help. And I think it has the potential to help in all the ways that we talked about. It helps, it kind of, I won't say forces people to exercise, but, I think left to our own devices, myself included, a lot of us are not as likely to exercise by coming here. It makes patients work on their cardio, work on their strength training, which I think a lot of times people wouldn't do at home. I mean, there were plenty of times when, especially in the beginning, when I felt like I really didn't want to come because I felt bad, but I made myself come. And then every time I felt better when I left, and I was so glad that I came. And I think that that would be the case for so many other patients. So I think it'll get them to exercise when they wouldn't otherwise be inclined. You have the close monitoring, so any anxiety component with working out, you can address because you've got monitoring equipment here and human beings. There's the social aspect of it, like we talked about, so it's always better to work out with a friend and to come here, but also like I got so much, especially early on, of talking to other people who had the same thing that I did and hearing their experiences. It was just very reassuring. And so, I mean, I think in every way it can benefit people, again, not only with primary lung problems, but with other chronic diseases as well.